Hello, this is Dr. Stanley Lang. Welcome to this video, and the topic today is my vertigo Lyme disease? And so the question came up because of the experience that I had with a patient about 3 weeks ago who was having symptoms that she'd actually been having for years. And I've actually seen her for these symptoms for years. And the question of whether I was dealing with Lyme disease or she was dealing with Lyme disease had never really crossed my mind until 3 weeks ago. And because the only reason it did is that she had a couple of other symptoms that were just a little bit funny, that didn't kind of match all of her other usual stuff. And I won't go into all the details, but this patient usually has a bunch of different things going on in addition to what we would call chronic fatigue syndrome kind of symptoms and fibromyalgia symptoms. So she's had all this stuff for years, but she was also complaining of a worsening of her vertigo. Now, the reason I think I probably thought that could this be Lyme disease was because I'd seen a couple of patients recently where the only symptom that the person was having was vertigo. It was the only symptom. And they got better with the treatment that we used. And in one case, the patient had a blood test that was absolutely positive, so there was no question. In the other case, the blood test was negative, but the person got better with the treatment, and the symptoms coincidentally resolved with the antibiotic therapy. So this patient, about 3 weeks ago, we started treatment. I saw her back today, and her symptoms had largely resolved. She was about 95% better. And across the spectrum, all of the symptoms that she was dealing with, including the vertigo, were improving. And some of these symptoms I'd been treating or attempting to treat for years and had really not thought about Lyme disease as being the actual problem that was going on. Well, in her case, she was very interested in what do I do next, because she'd done some reading about this. She understood that very few things you could do except continue to take the antibiotic, and she didn't really want to take the antibiotic. So this is somebody who is a natural fit for the natural Lyme disease treatment program that we've developed. Now, the other patient that I just mentioned that had just pure vertigo has not wanted to use this program because it's not as simple as taking a pill, an antibiotic pill. So I'm not trying to say that it's the right thing or the best thing to do. It's an alternative strategy for people that don't want to be on an antibiotic for months at a time, or maybe even for years, because that is the state for a lot of people who have chronic Lyme disease. And for some people who have vertigo, their doctor isn't inclined to start antibiotic therapy on the presumption that it might be Lyme disease. So they're kind of stuck with a situation where they can't really test the theory, could this possibly be Lyme disease? And the way you make the conclusion, of course, is you initiate a treatment. And if the symptoms resolve, while that's not proof, because of coincidental improvement with the treatment, it is certainly some evidence. And as time goes by, the person can conclude themselves whether or not it's sufficient evidence to continue the strategy. So the natural Lyme disease treatment program is completely safe. There's nothing toxic in it. There are 4 major elements that we focus on that I teach you about in the program. It basically, you purchase the information and then get the stuff that's part of the program. You buy it yourself. The point is, again, that Lyme disease has a lot of different presentations, and even vertigo can be the only symptom, but it may be, as in this person, a part of a bigger constellation of symptoms that are often misdiagnosed as fibromyalgia, chronic fatigue syndrome, or other things like that. So if that's you, I encourage you to give some thought to the possibility of a trial of using the natural treatment program. Since there's no medicines involved, nothing toxic, it can't harm you, and it might help you a considerable amount if you've got Lyme disease. So I hope you found this helpful. God bless and have a great day.